The nose is considered a sterile body orifice. Maintain excellent sterile technique during insertion of an NPA. Also, the nasal cavity has an easily disturbed rich blood supply and small delicate bones that could suffer an injury with rough handling. Disruption of the narrow nasal passageways could jeopardize the patency of the patient's airway. Indications. An NPA is beneficial for patients who present with a known or suspected gag reflex and an altered level of consciousness. The patient may present with evidence of compromised airway, such as a clenched jaw, snoring sounds, respiratory distress, blood, vomit, or foreign matter in the airway. One excellent example of a patient that typically requires an NPA to eliminate airway compromise is an unconscious seizure patient with irregular, labored, and shallow respiratory effort. Measure an NPA from the nares to the ear canal or the angle of the jaw on the same side. Usually, the length of the airway corresponds to the diameter. If the airway's length is correct, the diameter will also be correct. However, this is not always the case. Provided the diameter is correct, the length is adjustable by cutting the airway on an angle to emulate the bevel. Hence, it fits appropriately within the measured landmarks. It is better to have too short a nasal airway. If a nasal airway is too long, it could stimulate a gag reflex. This next part is crucial. After completing the measurement, lubricate the airway with a sterile, water-soluble lubricant like Surgilube. Look at the patient's anatomical features carefully. Is there a deviated septum? If you encounter a patient with a deviated septum, insert the airway into the nostril from which the deviation is moving away. Another way to pick the proper nares is to choose the larger one. Make more anatomical space for introducing the NPA by gently lifting the tip of the nose towards the patient's head. Adjust the airway so the bevel faces the septum as insertion of the nasal trumpet begins. Gently introduce the airway adjunct straight back until the flange is flush with the nostril. Always rotate the NPA into an appropriate direction of travel once the bevel has passed the septum. A common misconception is the nasal cavity travels in a cephalad or toward the head direction. You can see from the image that if introduced improperly, the airway could bind, cause trauma, or fail to reach its intended destination. Introduce nasal airways straight forward to the back of the head. Following the natural path of the nasal cavity, the airway will rest correctly.